Hello everyone, I am Shubha from Medical College Kolkata and welcome you all in Make Medical Easy. And today the result of weekly quiz 0.2, and in this video I will discuss each and every question with explanation, because previous quiz when it's happened you all mentioned that please Dada make explanation also. So now I want to start with question number 1. When there is a question that where upper lip and lower lip is fixed or mixed or attached, so there was option like laterally, medially. So first of all, this is the laterally, this is the center, and this is the laterally, so it's fixed the lateral. Now there is two options, one is angle of mandible or angle of mouth. So what is angle of mandible? So this is actually the angle of mandible, okay, and you can see this is the angle of mouth. So the lip is attached in the angle of mouth, not in angle of mandible. Coming to the next question, where there is question the lymphatic drainage of the lower lip, okay, and there is many option, but there is a one option is the molar, I think molar lymph node. The molar lymph node present is here, not below the lip. So lower lip cannot drain the lymph nodes which present is there. Okay, so which lymph nodes is actually present? The lower lip drains into that lymph nodes. So one is here and one is there. In this, there is the lymph node of the submandibular. This is the mandible. So submandibular lymph nodes, and there is the mental foramen of the mandible. So there is a lymph node. It's called submental lymph nodes. Okay. So the central part of the lower lip is drained in the submental, and the lateral part of the lower lip is drained in the submandibular. Now coming to the question number 3, where there is a pick the correct statement regarding Luding's angina. So in this scenario, there are many options. First of all, this is actually bilateral, not unilateral, bilateral. Second thing, you have to notice there is the roof is not actually inflamed. The floor is inflamed. Floor of the mouth is inflamed. Okay. And there is the most important thing is that first thing is the bilaterally. Second thing is the aggressively, there is a WBC count high, fever and chill. This is the option, actually right option. And there is another where is saying, wait. This is the, you can clearly notice in that there is the actually gangrene is present, but the pus formation is not there. The frank pus or no pus is there, but there is also the planted pus. So this is the wrong answer. So gangrene is there, but there is no pus formation. Okay. Now coming to the next question, aphthous ulcer के ऊपर एक क्वेश्चन था जिसमें लिखा हुआ था what is aphthous ulcer, and there are many like options. So you have to notice when we call an aphthous not aphthous ulcer, it's actually aphthous stomatitis. So when you call this is the stomatitis, traumatic stomatitis. When there is a trauma, when you bite, there is a trauma. So this is traumatic stomatitis. Aphthous is mainly due to steroid, malnutrition. In that cause, it is called aphthous. So what is the treatment? The antibiotic, vitamin B, vitamin C, because of the malnutrition. Okay. Now come to the candida stomatitis. Candida stomatitis means fungal infection, and there is a Vincent ulcerative stomatitis is for bacteria. So there are 4 types of stomatitis, and there is the actual cause of the stomatitis. Now coming to the next, when there is 4 terms like hemolysis, hemozoin, hemoptysis, and hematopoiesis and hematometer. First is the hemolysis. Hemolysis means the destruction of RBCs. Hemozoin means this is actually the formed element which actually formed by the digestion of the blood. Blood digestion होने के बाद कुछ parasites है like plasmodium, like some cystomas. So they are actually digest the RBCs and they form the like digestive formed material from the RBCs. This is called homozoin. Okay. And hematopoiesis is actually the formation of the cellular components of the blood or the blood plasma and the blood plasma. So this is actually the hematopoiesis. The answer is the same, hematopoiesis. And there is another option. There is the hematometers. Hematometers, you know, hemoglobinometer for estimate the hemoglobin. Okay. Now coming to the next question, where there is a question regarding the yellow bone marrow. So what is actually the yellow bone marrow? Yellow bone marrow is the mesenchyme, contain mainly mesenchymal stem cells or the marrow stromal cells, okay, which actually produce the fat, bone and cartilage. And the fat is present inside the yellow bone marrow is actually called the adipocytes, okay. And the mainly yellow bone marrow is present in the hollow cavity of the long bones, and it is surrounded by the red bone marrow. What is that meaning? Typically it's found center, yellow bone marrow in the center, and there is the surrounded by the red bone marrow. And there is an option red bone marrow in the center but surrounded by yellow bone marrow. This is the wrong answer. Okay. Now coming to the next question, where there is the when the hemoglobin is start forming in the RBC. So this is actually the pro-erythroblast. In this stage, the hemoglobin start forming. Coming to the next question, the caudal signs of the inflammation and what is the mechanism of the inflammation. First is the rubber. Rubber means the redness is the because of the stasis. In the color of the heat, it's mainly for the blood flow increase. A tumor is the edema or the swelling. Why it's caused? Because of the vascular permeability increase. And door of the pain, it's mainly for the chemical modulators. It's very easy. Now coming to there is 3 questions where I want to discuss. First of all, the transpsychosis. Pick up the incorrect statement regarding the transpsychosis. Okay. Cellular component recognition process of the acute inflammation. And there is one question in the vascular change acute inflammation में जो permeability increase, vascular permeability increase, it's by which mechanism? Okay, so I want to disclose these 3 questions with by these slides. First of all, the cellular receptors are toll-like receptors and inflammasome. Okay. Secondly, vascular permeability increased by contraction of the endothelium cells, then the direct injury of the endothelium cells, then the leukocyte-mediated vascular injury, and then the transpsychosis. Next, the contraction of the endothelium. This is actually by the chemical modulators. Endothelium injury by the burns. Endothelial injury due to leukocytes. And transpsychosis is the process of the transport of the fluid and the protein through the channels called vesicular organ. Okay? So this is actually the 3 questions. Now coming to the questions of the image questions. First of all, this is actually the histopathological slide of the stomach, and you can notice this is actually the gastric pits. Okay, this is the gastric pits. In this slide, this is the duodenum, and this actually the Bernard's glands. Okay, so this is actually the ileum, and this is actually the Paneth cells. Okay, and the remaining questions like hominid tendency, they are all actually discussed in our videos. I'll give the description of the each and every video. Please go through that. And now I want to disclose the winner of this week. Thank you so much. Please see. So now coming to the result part. Supratim Das scored 100%. Sudarshani Muktan 95%. Sanchari Ghosh, Dattatreya Mitro, Shayantan Basu scored 90%. Shayantan Pradhan, Monita Das scored 85%. And the 5th position is taken by his all juniors. Ankona Das, Adija Mal, Suchita Mahapatra, Arpan Dotto, Mourjo Groho, Mariam Haidar, Devapriya Maiti, Pushpendu Patra. So they all are taking the 5th position, and thank you so much to taking the part in this quiz. You can take part the MEDICOPEDIA, our monthly quiz sponsored by Dr. Bhatia and E Gurukul, and the first, second, third will be awarded. First will be awarded by the 3 months free subscription of the eGurukul 2.2. Second will be the 2 months and third will be the 1 month. फर्स्ट प्रॉप एग्जाम जो दिया है एंड जो फर्स्ट प्रॉप में है both can apply for the quiz and for the first year quiz and for the second year quiz though are just appeared for the second prop exam only these candidates will be applied for the second prop Medicopedia quiz. The link of the Medicopedia registration will be in the description and you will check out the website for our weekly winners. All the best for your future life and your future exams and future curriculum. And thank you so much for supporting me. Thank you so much.